Now there are the protocols for the diabetes mellitus is the type 2. Of course, that can be applicable to type 1 as well, but however, we cannot take the chance for the people who are using the insulin dependent diabetes mellitus is different from the non-insulin dependent diabetes mellitus. So therefore, we will think about that. We work on the type 2 diabetes mellitus as of now. So which majorly according to the great experience, here I wanted to add up the one specific point here, that point to be known as a pancreas point on the left auricle. On the left auricle there is a point called as a pancreas point. No doubt there are the numerous reasons to cause the diabetes mellitus, but however on the left side here, where the gallbladder is located on the right side of the ear, in the same location on the left side there is a pancreas point, and exactly we need to activate the one acupressure or acupuncture, or by using the embedding needle or the press needle or the Vaccaria sagittalis seed. Semen Vaccaria sagittalis seed, that the full name. That seed to be placed on the pancreas region on the auricle. That would be really good point for the continuously activation for whole day. So even you can place it for 30 minutes, you can place it for greater than 1 hour or 1 day, or maximum you can place that for 3 days. So once you can place it for 3 days, let it be there. Once you take the shower, it may fall down. You need not to worry. But however, if there is a press needle is there, keep pressing to that particular area. Give the pressure 1, 2, 3, 4, 5, 10. 10 counts, and again you just leave it. Again you go back and give the pressure for 10 counts for a few times. You just do it in that way, morning and night, to be activated in the regular intervals. So that would be better. So this is the only one point also helpful to treat for diabetes mellitus. But in fact, we wanted to add up some of the points as well as a supplementary point. That point to be known as a Ta Ling. Ta Ling means is the pericardium 7, P7. So which is located midway between the two tendons, palmaris longus and flexor carpi radialis tendon. So in between the two tendons, so especially on which side you need to apply. Either you can apply on the right side or you can apply on the left hand. But however, it's my opinion is better you just apply on the right hand would be better than the left hand. So therefore you just apply the one needle on the right side. So where exactly the P7 point is located. So on the ventral wrist crease, there are the two wrist creases. This is the dorsum wrist crease, this is the ventral wrist crease. On the ventral wrist crease, we just apply. Better I just apply on my left hand, better you can apply on the right hand, that would be better. You can use, there is a crease, this is the wrist crease. In the wrist crease you just place it in the center. In the center you just apply the pericardium 7, P7 point would be better to treat for the diabetes mellitus, because this particularly all the points which is connected to the pericardium meridian called as a metaphysical meridian, metaphysical organ. So that also indirectly to be known as a brain, indirectly to be known as a brain. So therefore there are the 5 points are there. 5 points works on the endocrine system. So there are the 5 endocrine points and 5 endocrine glands it works. But one point, this particularly the P7 point is good point to treat for the one particular endocrine gland, that gland to be known as a pancreas. So hopefully you know pancreas produces the 2 hormones. What are those hormones? One hormone to be known as a insulin, second hormone to be known as a glucagon. Right, insulin is essential to bring down the sugar level. Glucagon is essential to bring up the sugar level, because to making the equilibrium and balance each other. Because we do have the insulin, which is production of the insulin, which is essential to maintenance of the sugar level, that shouldn't go up or to control the diabetes. when the glucagon is there, so that insulin is not functioning properly. That time when the sugar level goes higher level, and that time insulin will protect, but however sugar level shouldn't go down, so that time it bring up to the higher level, that to be known as a glucagon is the hormone. So both are alpha cells and then beta cells. Alpha cells produced by the glucagon and beta cells produced by the insulin. So both are very much essential to regulate our glucose level. So therefore the pericardium 7 is the most imperative point to treat for the pancreas to work out for the two things, alpha cells and beta cells together. So therefore pericardium 7 is the great point to control on the right side according to Dr. Olds. So he is advising which is the left side meridian to be known as a spleen meridian, right side meridian to be known as a pancreas meridian. So therefore whenever we wanted to address by using the points, pancreas related problem can be treatable on the right hand side or the right leg, whereas in the spleen related problem, spleen is the great lymphatic system in our body. So of course then this to be treatable spleen on the left side of the hand and left side of the leg is advisable. Then the most imperative point to treat for the diabetes of course is the spleen 9 as well. So spleen 9 where the point is located and the anterior margin of the medial side of the knee in the depression of the tibial tuberosity. So this particular region where exactly the spleen 9 is the great tender point, all the women, especially after the marriage, women will get the pain on this specific region, or the people who are suffering for the knee pain. Most of the knee pain or the non-knee pain patients also gets the tenderness on the spleen 9. So where exactly spleen 9 is located? Spleen 9, the knee region on the medial side. So this is the right side of the knee. So now this is the lateral side of the knee and this is the medial side of the knee. So medial side of the knee you can find the tenderness on this region. Is a great point to regulate the metabolism of the food, and also this is advisable to treat for the menstruation related disorders, and of course is a great point to treat for the diabetes mellitus as well, because when spleen 9 is the point is sedative point, that means is the depletion point, decreasing the energy point, that point is passing the energy to the regulating the energy to the kidney system. Spleen 9 is equivalent to the kidney 3, right? So therefore whenever there is a metabolism is not good, when the absorption of the food is more accumulated or the retention of the food is more accumulated, because the ingestion, digestion, absorption, assimilation, ejection, these are the 5 processes from the mouth to anus. If this ingestion means is the food intake. So after the intake of the food, then that will convert in the form of the, that will convert immediately in the form of the glucose. Because that the process you remember that once you injection means administration of the drug, ingestion, right? Instead of C, that is E. So ingestion, that means is the intake process of the intake of the food to be known as a ingestion, right? So once we take the food, so that will be mixed with the saliva, that's called as a bolus, B-O-L-U-S, bolus. So that once mixed with the saliva, that is the beauty of, I think we were discussing with the Dr. Ravi Shankarji, also addressed that. So once mixed with the saliva, then that should be passed to the esophagus. After the esophagus going to the stomach, then it is the retention of the food. So after the retention of the food, there are the inside, there are the gastric juices produces, that's called as a all acidic juices. That's called as a, perhaps you know that hydrochloric acid is not the alkaline, it's the acidic nature. So once we'll mix it with the food for the with the gastric juices, that will produce one kind of the chyme, chyme. That chyme is mixed with the lower portion of the stomach inside the food, then that will goes to the duodenum. From the duodenum it absorbs. What it absorbs? It absorbs the food contents. Whatever you had, that water and then food. So that food absorption to be taken place precisely in the spleen. So in this duodenum, from the duodenum there is a branch goes to the pancreas. From the pancreas the spleen is connected. So therefore that pathway to be taken place as a digestion. The absorption where the digestion to be taken place, especially on the spleen. So spleen will mix with the air. That means in the lungs. So the lungs having the good ability to mix it with the food is mixed with the air, where we can take the breathing will be good. Right? If this process is not good, so that time the digestion will not taken place precisely. It is the more retention of the food is there in the stomach. Of course, in the spleen is transformation is not taken place by the spleen. So that time what to be done? Deplete the energy of the deplete means is the decrease the energy of the spleen, that passing where the retention is there, that will bring down that passing to the renal system, where the water metabolism to be taken place precisely, the blood metabolism is taken place precisely once the renal system is good. So therefore spleen 9 is the sedative point. One way is good to regulate the diabetes mellitus. You remember when the patient having the bloating of the stomach, flatulence means is the gas is passing out through the anal region. How the puking sensation or the burping is coming out through the mouth, and then flatulence is going gas towards the anal region. But this is upward going is the disease, but downwards going is the harmony. But continuously passing the flatulence also not good, because the bad odor will be there. If the good odor, that means odor is not there, that is one way is presentable. Bad odor is there, that is the retention of the food, which leads to the several illness. So therefore deplete the energy of the spleen by using the spleen 9 also really good. So however we can add up the spleen 9 is the one particular point is really great point. The second point to be known as a even spleen 6 also good point. Spleen 6, where exactly is the junction of the spleen, liver, kidney. You all know that where the point is located, 3 chun proximal. 3 chun proximal to the tip of the medial malleolus on the posterior border of the tibia. So once you activate that particular point, because you remember there are the 2 points are located here. One point to be known as a chiaxin, the second point to be known as a sun in chio. Chiaxin is K8. K8 and then spleen 6. That entire area to be known as a lower tantian, where exactly there are the meeting point. There are the 2 lower tantian. One tantian to be known as a here below the navel, the another tantian on the lower portion. Tantian means is the communicating region or the junction or the place where the Coot road, where exactly 4 different roads will join together, right? So there are the 3 organs are joining together on a specific area or the junction to be known as a entire area. For example, there is a circle of the 1 inch 23 radius, you can find that soningio and then chioxin, K8 and then spleen 6. That entire area to be known as a junction point where the spleen, liver, kidney is the connecting point. But how to select the point? From where to select? You remember, this we normally does a mistake. But at the point spleen 6 is located 3 chun proximal to the tip of the medial malleolus. Tip, remember, otherwise you will come in the other level. Maybe you come, this is the malleolus. You come above the malleolus, then you measure the 4 fingers. That's wrong. But the point anatomically where is located? 2 chun proximal to the tip of the medial malleolus, the point to be known at the border of the tibia, the point to be known as a K8. K8. Then the 3 chun proximal to the tip of the medial malleolus, that point to be known as a spleen 6. Spleen 6 and then K8. In between, you wanted to activate that specific region. By activating the pressure on that specific region is a great impact to be taken place. But certainly these are the 2 points also good point to treat for the diabetes. Especially this point is selected on the right side of the leg. If you wanted to use on the left side, also there is no harm, because the meridians according to the TCM symmetrical, both the sides are going. So therefore you wanted to apply, you can apply right side or left side, vice versa, but better you can use it on the right side would be better, because the duodenum is connected on the middle of the abdominal region. Then you are connecting, you are giving the signal to the duodenum with the support of the gallbladder, because the gallbladder is located on the right side. Until unless gallbladder will not support, where the alkaline bile is stored in the green yellowish color of the alkaline fluid is secretion by the liver and then stored in the gallbladder, that will be producing the supplying to the duodenum. So through the duodenum it is passing to the pancreas and then spleen. In that pathway is good, which is located on the right side. So therefore the spleen pancreas related problem can be treatable on the right side. Spleen related problem is more predominantly located on the left side. Thereby we can use it, the spleen meridian on the left side would be preferable. So then you wanted to use the insulin production point is the really great point. I wanted to highlight you here, that point to be known as a Wei Quan Xia Shu. So this point, where is it located? So that 1.5 chun. 1.5 chun. Where is that point? You just find out. This is the scapula. This is the scapula. So pit of the scapula or the tip or the lower border of the scapula. So we'll show you practical demonstration. Perhaps when I take the practical classes, that time I'll try to show you where precisely that point is located. You come down. This is the tip of the, this is the end of the scapula. So once the end of the scapula, how to touch and feel? Ask them to do like this. Ask them to do like this. Then you try to find out. Prominent scapula is the shoulder blade. So through that blade you just come down where the shoulder gets completed. Then this completed here. Then come here to the spine. Come towards the spine. So that area, 7th thoracic vertebra. Just distal to the 7th thoracic vertebra is the 8th thoracic vertebra. Yes or no? So on the 8th thoracic vertebra, exactly this particular region, 1.5 chun lateral to the midline of the spine, lower border of the spinous process of the, if you have confusion about it, don't worry about it. Try to find out. Give the pressure on the specific region. If the patient feel I do have the pain or the tenderness or some kind of the sensitiveness reaction over that region, then you just activate. Sir, which direction? Either right or left to be applicable. But you can use it bilaterally. It's good. Or you wanted to use right side would be more preferable. So right side give the pressure on that region. Try to find out. Yes, patient feel the tenderness. Activate that particular point. That will be really helpful to treat for the insulin production point to be known as a Wei Kuan. Wei means is the outside. Kuan means is the gate. Sia means is a small. Shu means is the point. So Veikwan Sia Shu point is treatable for the splanchnic nerve. That nerve to be known as a splanchnic nerve or splanchnic ganglion. That another name also to be known as a celiac ganglion. So celiac ganglion, from there the autonomic nervous system is connecting to that particular region. Through that ganglion, which is internally connecting to our abdominal organs, that is the trunk organs, right? So that is connecting to the pancreas, that's connecting to the spleen as well. So therefore, which is the most important, once we activate from the back level, right? So that indirectly giving the alarm and alertness when the pancreas is sleeping, is not functioning precisely, you are pushing the needle to the downwards direction. Make sure that you shouldn't go to the greater than 1.5 chun, but make sure that 1 chun needle maximum, the depth for the adult, you can insert the needle, but not more than that, not more than that. If you activate greater than that, hopefully the internal viscera is there. Viscera means is organs that may damage to the internal orbs.